What sort of trends do you see amongst your clientele? Do you have women from the non-celeb circles visiting you as well?
India has changed a lot. I used to be in practice in India in about 2003, and now I'm in practice in India in 2012, and it looks like a different country. I remember I was in Hyderabad in 2003, and literally there were no cosmetic surgeries coming in because people thought cosmetic surgeries were for people who were vain, and I think even caring about looks was something which was a taboo in Indian social culture. Now things have changed. I see more spaghetti straps on the street than I do in California sometimes. So India seems to be changing really quickly. The amount of disposable income has increased, and with that, everyone has started believing that you live only once, and therefore you have a choice to look the best you can at that point in time. So I see in my clientele nowadays, hardly 10% are celebrities in that sense. It's the common man, people like you and me, who want to go ahead and get surgery done. Because like a patient of mine who was 60 years old, so this patient of mine was 60 years old, was the general manager of a public sector oil company. So he's probably not the richest man in the world, but he turns around and he says, look, I'm 60. If I can, at 60, I can look like I'm 40 and I can afford it, why shouldn't I? So I think that's the major mega shift which has occurred in the thinking, by which people are turning around and saying, look, I have only one life, I better make the best of it. I have the income generated which is in excess and I can take care of my needs. And looking good has almost become like wearing an Armani suit. If I can afford it, I will do it. That's the mega change that I see which has come about in my profession in over the last couple of years.
Well, Doctor, it was a pleasure having you. Thank you for joining us.
Thank you for having me here.
For more such information related to your health, log on to health.india.com.